Hey everyone, and welcome back to the Lenny and Rhea Deep Dive podcast show at notebooklmpodcasts.com. I'm Lenny, and one thing I've been thinking about lately, it's how we always assume life expectancy just keeps going up,
Ah,
with all the medical advancements and everything.
it makes sense, right? Like healthier lifestyles, new discoveries, we should be living longer than ever.
Right, but get this, that's not actually what's happening.
Yeah, it's kind of mind-blowing, actually. We're seeing the opposite. Life expectancy is going down, and that's what we're going to unpack today.
Exactly. We're using this really interesting and maybe a little bit controversial article from Principia Scientific in Cell called Why Has Life Expectancy Started to Fall?
All right, so before we get all doom and gloom, let's rewind a bit. Over the last century, life expectancy has exploded.
Seriously, it's like doubled in most places since the 1900s, which is crazy.
I know, right? Better sanitation, vaccines, antibiotics. We've basically kicked the butt of so many diseases that used to just wipe people out.
It's really incredible when you think about it.
But here's the thing. Around 2010, that upward trend, it basically hit a brick wall.
Seriously,
Yeah.
just stopped.
Globally, yeah, life expectancy actually started to go down. And in the US, it's been flatlining for even longer.
Wait, how long are we talking about?
Like 3 decades. It's
Sure.
not just a small dip, it's this big, sustained shift. And researchers are kind of freaking out.
I can imagine. So how do they even figure out life expectancy? Is it like a magic 8-ball or something?
Not quite. They use something called period life expectancy. It's basically like, imagine you were born today.
Okay.
They look at how many people are dying at different ages right now, and then use that to guess how long you might live if those death rates stayed the same.
So it's like a snapshot of what's going on right now. And that snapshot is telling us something is wrong.
Totally. Now, this article we're looking at introduces a new idea called biopolitical. It's about how policies and stuff directly impact health outcomes.
Bio what now?
Biopolitical. Basically, it means if life expectancy is going down, it might not just be because of individual choices.
Okay, I'm listening.
It could be bigger problems like policies or how our healthcare system works.
So this biopolitical idea is basically saying we need to look at the bigger picture, not just blame individuals.
Yeah, it's saying maybe the environment is making it harder to be healthy, not just people making bad choices.
I'm starting to get it.
Huh.
So what are some of the big systemic issues they're talking about?
One major thing they point to is the rise of chronic diseases like heart disease, cancer, and diabetes. Starting around 1990, we saw this huge increase in these conditions, and it kind of lines up with when life expectancy stopped going up.
Wait, so are they saying these diseases are the reason we're not living as long?
Pretty much, yeah. And they zoom in on the U.S. as a big example. We spend tons of money on healthcare, more than any other country.
We do, that's true.
But our life expectancy is only average compared to other developed countries.
That's kind of messed up, isn't it? Spending the most, but not getting the best results.
It is, and the article links this back to that biopolitical failure idea. You're saying our system isn't focused on health the right way.
I'm definitely intrigued now. What exactly are they saying is going wrong?
Well, brace yourself for this one. 90% of all U.S. healthcare spending goes toward managing chronic diseases.
90%. So we're just playing catch-up instead of stopping these diseases in the first place.
Basically, the article argues that our system is designed to treat sickness, not promote being healthy.
Wow, that's kind of depressing. If that's the case in the U.S., where we spend so much on healthcare, what's happening in other parts of the world?
This isn't just an American thing, unfortunately. In Europe, 70% of deaths are from chronic diseases. Latin America is dealing with rising obesity rates. It's everywhere.
So this is a global problem, not just a U.S. problem.
Exactly. This is getting pretty intense, so why don't we take a quick pause? We'll be right back with part 2 of this deep dive. And we're back to the Lenny and Maria Deep Dive podcast show at notebooklmpodcasts.com. We're talking about why life expectancy is dropping and this whole biopolitical thing, remember, where policies can actually affect our health.
It's a crazy idea to think about, but it makes you wonder how much our environment shapes our health without us even realizing it.
Right. And a big thing this article criticizes is our medical system. They say it's amazing at handling those sudden emergencies, like if you break a bone or get a bad infection.
Right.
But when it comes to chronic diseases, the ones that develop slowly over time.
It's like we're trying to fix a broken leg with a Band-Aid.
Totally. The article claims that medical training focuses way too much on just diagnosing and treating, not enough on actually preventing these diseases.
So we're training doctors to be firefighters, but not architects. Great at putting out the fires of disease, but not so good at stopping them from starting in the first place.
Exactly. The article even says medical schools focus more on what to think, not how to think critically.
Hmm, interesting.
And they argue that this leads to relying too much on medications, even when simple things like lifestyle changes might be better.
So are they saying doctors aren't taught to think for themselves?
Not exactly, but they're hinting that the system pushes a certain way of doing things, and it might not always be what's best for the patient.
So if our system focuses so much on treatment, what does the article suggest we do differently? It's easy to complain, but what are the solutions?
Well, this is where it gets interesting. They have a whole bunch of ideas for how to focus more on prevention and a more well-rounded approach to health.
Okay, lay it on me.
First off, they're big on lifestyle choices. Diet, exercise, sleep, stress, the basics. They say these things have a huge impact.
Yeah, but it's harder than it sounds. I know I should eat more veggies and sleep more, but life gets in the way.
And that's where the biopolitical part comes in. They argue we need policies that actually make healthy choices easier.
I see what you mean.
Think about things like taxing sugary drinks so people buy them less, or making fresh produce cheaper.
So it's not just about telling people to eat healthy, it's about making healthy choices the easy choice.
Exactly. They also talk about stuff like investing in parks, encouraging workplace wellness programs, and even designing cities so walking and biking are easier.
Okay, so making healthy choices the default option, not the exception. What about the medical system itself? How do we switch from treatment to prevention there?
They have some pretty radical ideas there too, like completely changing medical education to focus more on things like nutrition, preventative medicine, and lifestyle counseling.
So instead of just giving out pills, doctors would actually help patients make real changes to their habits.
Exactly. They'd be like health coaches, working with patients to fix the root causes of their problems, not just mask the symptoms.
That sounds amazing, but how realistic is it to change how we train all doctors?
It's a big challenge, but the article mentions some encouraging signs. More and more people are realizing the limits of how we do things now, and more doctors are looking for training in stuff like functional medicine and integrative health.
So it's a slow change, but it's happening.
And that brings us to the food system, another big area the article tackles.
Oh yeah, food. I have a feeling they don't hold back there.
You're right. They go all in, saying the modern food industry is a huge reason why so many people have chronic diseases. Processed foods, artificial ingredients, pesticides, they call them out big time.
So they're basically saying our food is making us sick, and then companies profit from treating those illnesses.
Pretty much. And their solution, moving away from those massive industrial farms that use so many chemicals and moving towards more sustainable practices.
Like smaller farms, more variety of crops, less pesticide use.
Exactly. They talk about things like regenerative agriculture, permaculture, focusing on local food. It's about working with nature, not fighting it.
That sounds great in theory, but realistically, how do we get there?
They suggest a multi-pronged approach. Policy changes that make sustainable practices more appealing for farmers.
Okay, like what?
Things like tax breaks for small farms, subsidies for organic farming, and stricter rules about using pesticides.
So basically making it easier and more profitable for farmers to do the right thing.
Exactly. But they also emphasize the power of us, the consumers. We can vote with our wallets, support local farmers, buy organic, and eat less processed junk.
It's about showing the food industry that we want healthier, more sustainable choices.
Right, and it goes beyond just the farms. They talk about food deserts, too. You know those areas where people can't easily get fresh, affordable food?
Yeah, it's tough to eat healthy when the only options are fast food and convenience stores.
They suggest solutions like community gardens, mobile farmers markets, and programs that encourage grocery stores to open in those underserved areas.
Wow, so this is about completely changing our relationship with food, from how it's grown to how we buy it.
It's a big vision, but they believe it's absolutely necessary if we want to be healthier as a society.
But what about healthcare? It seems like they want some major changes there as well.
Oh, definitely. Remember how we talked about focusing too much on treatment instead of prevention?
Yeah.
They want to totally revamp medical education to emphasize nutrition, lifestyle medicine, and preventing health problems before they even start.
So instead of just handing out prescriptions, doctors would be trained to help patients tackle the root causes of their health issues.
Exactly. They'd be more like partners in your health journey, not just someone who gives you medicine.
It's a more holistic approach, which makes a lot of sense.
That's the idea. They even suggest including things like functional medicine and integrative health in medical school.
Wow, that would be a huge change. But would it actually work?
Well, the article claims we're already seeing a shift in that direction. More and more people are looking for those holistic approaches, both patients and doctors.
So maybe there's hope for the system to change from the inside out.
They seem to think so. And speaking of hope, they point out a few other reasons to be optimistic.
Okay, I need some good news right now. What are they?
Well, for one, they say more people are aware of these issues now. The fact that we're talking about it on this podcast means people are starting to wake up to the problems.
True, there's definitely a growing movement toward living healthier and more sustainably.
Exactly. They also mention the rise of alternative healthcare, like acupuncture, massage, and naturopathic medicine. It shows people are looking for solutions beyond conventional medicine.
So people are taking their health into their own hands, trying different things to find what works for them.
Exactly. And lastly, they highlight the growing research on things like the microbiome, epigenetics, and how environmental toxins affect us. It means we're finally understanding the complex things that impact our health.
Like we're putting the pieces of the puzzle together.
And that's what makes this whole biopolitical shift so important. The more we understand how these big systems affect us, the better we can push for changes that actually help.
It's realizing that our health isn't just about our choices. It's about the air, the food, where we live, and the policies that shape our world.
Exactly. And that's what makes this conversation so empowering. We're not just victims. We have the power to change things both individually and together.
So what's the main message for our listeners? What can they do starting today to be part of this change?
First, educate yourself. The more you know about this stuff, the better decisions you can make for yourself and your family.
Read books, listen to podcasts, do your own research.
Exactly. Then make changes in your own life. Start eating better, move more, reduce your exposure to toxins. Even small steps make a difference.
And support businesses that align with your values.
Yes. And most importantly, get involved in your community. Push for policies that promote health and sustainability, support local farms, volunteer at a community garden.
It's all about realizing that our health is connected. We all have a part to play in making the world healthier.
Well said. The challenges are big, but there's also so much hope. By working together, we can change things and create a future where everyone has the chance to truly thrive.
Welcome back to the Lenny and Maria Deep Dive Podcast Show at notebooklmpodcasts.com. We've been talking about this pretty heady stuff, falling life expectancy and this biopolitical idea where the choices we make aren't the only thing affecting our health.
Yeah, it's been a lot. But the question is, what can we actually do about it? This article isn't all doom and gloom. It actually offers some ways forward.
Okay, good. I'm ready for some solutions. So what can we do, both on a personal level and as a society, to turn things around?
Well, remember how the article pointed to our food system as a major culprit in this whole chronic disease mess?
Yeah, they were pretty harsh on processed foods and industrial agriculture.
Definitely not fans. They suggest basically overhauling the system, moving away from those massive farms that rely on pesticides and chemicals.
And instead going for what? Like smaller, more natural farms?
Exactly. They talk about regenerative agriculture, permaculture, and focusing on more local food systems. Working with nature, not against it.
Sounds great, but how do we actually get there? It seems like a huge undertaking.
It's a multi-pronged approach. The article talks about changing policies to make these sustainable practices more appealing to farmers.
Give me some examples.
Things like tax breaks for small farms, subsidies for organic farming, and stricter regulations on pesticide use.
Ah, I see. So making it easier and more profitable for farmers to do the right thing.
Right. But it's not just about the farmers, it's about us too. We have power as consumers. We can vote with our dollars by supporting local farms, buying organic, and just eating less processed junk.
Sending a message to the food industry that we want healthier, more sustainable options. I like it.
And they also bring up food deserts, those areas where people have trouble getting fresh, affordable food.
Yeah, it's hard to eat healthy when all you have is fast food and convenience stores.
Totally. They suggest things like community gardens, mobile farmers markets, and programs that help grocery stores open in those underserved areas.
So this is about changing our whole relationship with food, how we grow it, how we buy it, everything.
It's a big vision, but the article argues it's crucial if we want a healthier society.
And what about healthcare? It sounds like they want to see some major changes there, too.
Totally. Remember how we talked about how the system focuses too much on treatment and not enough on prevention?
Right.
Well, they propose a pretty radical change in medical education. More focus on nutrition, lifestyle medicine, and stopping problems before they start.
So doctors would be trained to help patients actually address the root causes of their health issues, not just mask the symptoms.
Exactly. They'd be like partners in your health journey, not just someone who writes prescriptions.
That's a much better way to look at it. But how realistic is it to change how we train all doctors?
It's a big challenge, but the article mentions some encouraging signs. More and more people are realizing the limits of how we do things now. Both patients and doctors are looking for alternatives.
So maybe the system can change from within.
They seem to think so. And speaking of hope, they highlight a few other reasons to be optimistic.
Okay, lay 'em on me. I'm ready for some good news.
Well, first, they point to the fact that we're even having this conversation. More and more people are aware of these problems, and that's a good start.
True, there's definitely a growing movement towards healthier and more sustainable living these days.
Exactly. They also talk about the rise of alternative healthcare, like acupuncture, massage, and naturopathic medicine. It shows that people are looking for solutions beyond conventional medicine.
So people are being proactive, trying different things to find what works for them.
Yeah. And finally, they highlight the growing research on things like the microbiome, epigenetics, and the role of environmental toxins. We're getting a much deeper understanding of the things that impact our health.
Like we're finally putting the pieces together.
Exactly. And that's what makes this whole biopolitical shift so important. The more we understand how these bigger systems impact us, the more we can advocate for real change.
It's about realizing that our health isn't just about our individual choices. It's also about the world around us.
And that's what makes this whole conversation so empowering. We're not just passive victims. We can actually shape our health destiny.
So what's the takeaway for our listeners?
Yeah.
What can they do, starting today, to be part of this biopolitical shift?
I think the first step is to educate yourself. The more you understand about these issues, the better choices you can make for yourself and your family.
Read books, listen to podcasts, do your own research.
Exactly. And then take action in your own life, Make changes to your diet, get more exercise, reduce your exposure to toxins. Even small things add up.
Vote with your dollars. Support businesses that are doing things right.
And most importantly, get involved in your community. Advocate for policies that support health and sustainability. Support your local farmers. Volunteer at a community garden.
It's about realizing that we're all connected. We all have a role to play in creating a healthier world.
Couldn't have said it better myself. The challenges are real, but there's also so much hope. If we work together, we can really make a difference and create a better future for everyone.
This is Lenny.
Again, Maria?
Signing off from the Lenny and Maria Deep Dive Podcast Show at notebooklmpodcasts.com. Thanks for joining us on this deep dive into the sometimes confusing, but ultimately hopeful world of health and longevity.